Hi all, welcome to the Prosthodontics lecture series. The topic for discussion today is articulators. I am Dr. S. Anand, Professor, Department of Prosthodontics, Adiparasakti Dental College. Articulator is a mechanical instrument. It represents the temporomandibular joints and jaws, to which the maxillary and mandibular casts are attached to simulate some or all mandibular movements. So it is a simple mechanical instrument. It can be a simple mechanical instrument or it can be a complex mechanical instrument. But the main idea is to hold the maxillary and mandibular cast in position to understand the occlusion. The uses. It helps to diagnose the state of occlusion, that is, the existing state of occlusion of the patient. For a dentulous patient. In an edentulous patient, it helps to establish the maxillomandibular relationship using occlusal rims. It helps in treatment planning. It helps for the teeth arrangement in a completely edentulous state. It helps in fabrication of prosthesis in both removable and fixed partial dentures. It also aids the operator to explain the treatment procedure to the patient in an understandable manner. And it also gives you a clinical outcome or the result of the final prosthesis. This is very helpful in teaching the patient or to motivate the patient for the treatment. The main advantage of an articulator is when you mount the maxillary and mandibular occlusal cast in the articulator, you can able to view the lingual occlusion, which is not possible intraorally with the conventional diagnostic aids. And it also requires less chair time of the patient to establish a proper occlusion or to do a teeth arrangement, and will not have any interferences from the other oral structures, including your cheeks and your tongue. So coming to the parts of an articulator. Any articulator comprises of the basic parts. That includes the upper member, the lower member, incisal pin, incisal guide table, an anterior reference pin, and a mounting discs. It also has your condylar element and condylar guidance. For any instrument, for any equipment to be in dentistry, to be used in dentistry, shall possess a minimal requirements. So the basic requirement for an articulator includes to hold the cast in correct horizontal and vertical relationship. Allow sufficient space between the upper and the lower member. And it should have a positive anterior vertical stop. And one more thing, the cast should be removable and reattachable, because you cannot buy a new articulator for multiple number of cases. So that articulator should have the possibility to remove and reattach the different casts. It should open and close in proper hinge access. It should accept face bow transfer, and it should be made of non-corrosive material. All the movable parts of your articulator should be freely moving, and the rigid part should be rigid. The additional requirements that includes, it should allow protrusive and lateral movements, and should have an adjustable horizontal condylar guidance, and it should accept Bennett movement. Apart from that, it should have a customizable incisal guide table, adjustable intercondylar distance. Now we come to the classification of articulators. The articulators can be classified into various types based on various conditions. The first thing, based on the theories of occlusion. It can be Bonville theory or equilateral triangle theory, or spherical theory and conical theory. Bonville theory is also called as theory of equilateral triangle. The equilateral triangle is like joining both the condyles, and the line joining condyle and the contact point of mandibular incisors form an equilateral triangle of 4 inches. Conical theory, it was proposed by Hall, in which he states that the lower teeth moves over the surface of the upper teeth as over the surface of the cone, and it generates an angle of 45 degrees with the central axis of the cone tipped at 45 degrees to the occlusal plane. Spherical theory, also known as Monsoon's theory, it is based on the concept that the lower teeth moves over the surface of the sphere. Here, the center of the sphere is having a diameter of 8 inches with the center in the glabella. Second, based on the adjustability, it can be classified into adjustable, semi-adjustable, and non-adjustable. So it should accept face bow transfer, it accepts protrusive record, lateral record, and Bennett movement. It also has a adjustable condylar guidance. So if all these 5 criteria is acceptable, then it is called as a fully adjustable articulators. When any of these 3 criteria is accepted, it is called as a semi-adjustable articulator. If the articulator does not fulfill any of these first 3 criteria, then it is called as a non-adjustable articulator. Based on the position of the condylar element, Breckstrom classified that into Archon and non-Archon articulators. An Archon articulator basically was derived from the term articulator and condyle. So the condylar element is attached to the lower member, and the condylar guidance is attached to the upper member of the articulator. It simulates the patient's TMJ. So this type of articulators are called as Archon articulators. They are most commonly used for fabrication of full mouth rehabilitation. Advantage: the relation between the occlusal plane and condylar inclination does not change when the vertical dimension changes. The upper and the lower member can be separated. This picture shows the opening axis of your maxilla and mandible. So this exactly simulates the natural jaw movement. Non-Archon articulator, the condylar element is attached to the upper member and the condylar guidance is attached to the lower member of the articulator. This is the vice versa of the natural temporomandibular joint. It is used for complete denture fabrications. It has very less accurate than the Archon articulator. The upper and lower member cannot be separated, hence difficulty in wax-up procedures, and it cannot accept kinematic pace bar. The relationship between the occlusal plane and the condylar inclinations changes when the vertical dimension changes in a non-Archon articulator. And then there is a University of Michigan classification. They proposed this classification during the World Prosthodontic Congress held in 1972. They classified articulators into 4 classes: class 1, class 2, class 3, and class 4. The class 1 articulator are a simple holding instrument capable of accepting single static registration. Only vertical movement is possible. Example, a barn door hinge articulator. Imagine like your door opening and closing, just an hinge movement. There is one simple movement, open and close. Class 2 articulators are those that permit vertical and horizontal movements but do not accept face bow transfer. Again, class 2 can be classified into type 1 and type 2. So type 1, it has a limited eccentric movement based on the average value. The example for a type 1 class 2 articulators are mean value articulators. Type 2 articulator, they have a limited eccentric movement based on the theories of arbitrary motion. Example is Hall's conical theory articulator. Then the third one is limited eccentric movement is possible based on engraving record obtained from the patient. That is your House articulator. All the class 2 articulators does not accept face power. Class 3 articulators are articulator which permits vertical and horizontal movements. It also accepts the phase bow transform. Type A. Again, the class 3 articulators can be classified into type A and type B. Type A articulators, they accept static protrusive record and use equivalent for other type of motion. Example, Hanav H articulators. Whereas type B articulators, they accept static lateral protrusive record and use equivalent for other type of motion. Example, Hanav University series of articulator. Then comes your class 4 articulators. They are the most advanced type of articulators. They accept three-dimensional dynamic registration. It can reproduce the condylar path accurately, and it can be classified into type A, type B. Type A articulators, the condylar path is determined by engraving the registration obtained from the patients. For example, for type A articulators are TMJ articulators. Type B articulators, they are similar to type A, but allow angulation and customization of condylar path. Example, Steward instrument. The articulators plays a major role in construction of any prosthesis in complete dentures. Any prosthesis in prosthodontics. Either it can be a simple removable partial denture, or it can be a complex cast partial denture, or it can be fixed partial denture, full mouth rehabilitation, or even implant supported crowns. For everything, articulator plays a pivotal role. The knowledge about the articulators gives the practitioner or the clinician or the operator to understand the occlusion perfectly and to deliver a prosthesis which not only improves the aesthetics, it also improves the functional requirements of the patient. Thank you for the patient listening, and we are always happy to answer all your questions. Thank you.